Hi, this is Dr. Tong again. The next case we're gonna prove to you lupus, arthritis, and mental depression, suicidal mental depression can be cured without the use of drugs. And with me here is Lynda. Lynda, why didn't you tell them what brings you to see me in the first place, like a few years ago?
I was sick, tired of being sick and being accused.
Speak a little louder, yeah.
I was sick and tired of being sick, and when I heard your voice that you could help, that's when I wrote your phone number down, and you called me the very next morning and made an appointment.
Okay.
And on the first treatment, I knew right then and there I wasn't going to go back to nobody but Dr. Tong.
Good for you, okay. What were you suffering at that time?
Mostly depression.
Depression.
Yeah.
But you were having a lot of pain too.
Oh yeah, the lupus had came back on, it was in remission.
Oh,
and it came back on my body to the point where I was really suffering with the mental depression, with the pain.
Okay, how long have you had the depression, and how long have you had the lupus? How long were you diagnosed?
I think it was in the 70s, and all that time I just laid around.
30, 40 years.
Yeah, about 35 to 40 years. Nobody took care of me. I just had to lay and suffer.
So you saw a lot of psychiatrists?
They kept sending me to psychiatrists and sending them to me,
and you take the drugs?
They wanted me to take them, but I did not want to take them, so they forced me to take them until I got out of the place.
Yeah, you told me one time you were, recently you were in the hospital for 7 weeks, and the nurse forced you to take the medication. Tell us about that.
Yes, she said that I had to take the medication. She had a handful of little pills, medication, and I said, I do not want to take those pills. I have not been taking no pills because I want to keep my mind straight.
Yes.
And she said, well, like, you're going to take them or else I'll push them down your throat. And she caught and held onto the collar, my collar, and forced them down me. And so then right after that, I went ahead and took them till I got out of there.
How about your lupus? How long have you had the lupus?
They said for my son, he was in service because in the 70s, late 70s, and saying that I had lupus and I was dying.
Who diagnosed it?
Lynda.
Lynda diagnosed it.
Took them 3 weeks to find it out. They kept searching, did not know what it was, but it took 3 weeks with all the doctors at the foot of my bed. Finally, they decided it wasn't leukemia, that it was lupus.
So how long did they work you up before they sent you to Lynda?
There was 5 times I went another hospital in and out, being treated there. And all they could do was just keep me drugged up with pain shots. Very strong.
So where were your pain?
My whole body.
Your whole body?
Couldn't stand clothes, couldn't stand touching anything. It was really bad.
No wonder they send you see a psychiatrist.
I had seen so many of them and never knew what they were until,
Okay, listen to this, okay? It doesn't matter what you call it, lupus, rheumatoid arthritis, polymyalgia rheumatica. I have a patient that was diagnosed with polymyalgia rheumatica, and after 3 or 4 years, 4 years of taking the drugs, it doesn't work. And they put her in the hospital a whole week, and they say, no, you don't have polymyalgia rheumatica, you have lupus. And they put her back on the same drugs, as if now changing the diagnosis, the drug will work, when the drug has failed like 4.5 years. That is how we waste all our money. But anyway, you start coming to see us about a few years ago, 2010, okay? But Medicare only allow 3 treatments every 2 months. And many times you probably skip because you cannot get a ride. Now you find a train ride, which is much easier. When you first came to see me a few years ago, how much pain you have? What were you suffering?
Oh, I was really in pain. And I wanted to take pain medication. The only time I would is when I had problems with my teeth or earache. But otherwise, I just laid and suffered because I didn't want to be drugged up.
How about mentally? How about your depression?
It was just kept getting worse and worse until I started seeing Dr. Tong, and now I can say it works.
Okay, we'll talk about how you feel right now. So at that time, were you suicidal? You told me you were kind of, yeah.
I was, but yet I knew it was wrong by, trusting in God.
So today, when you first came in, you were on a walker because I didn't see you in the past. Okay, so what kind of pain were you suffering for you to need the walker?
To the point I just feel like I was falling because I was weak. It was hard to get up out of my seat when I get on the train or the bus.
Mm-hmm.
And with the walker, and they help me.
Okay, let's see you get up without your hands. So put your hand out. See, that's pretty good. Do you feel you need the walker?
No, I really don't think so, but I'll...
So you did feel weak before, right?
Oh yeah, really weak. When I came in today, I barely could, really walk. I was really weak.
Okay, and you had a lot of pain in the knees.
Oh yes.
So how's your pain now after my treatment?
I don't have no pain.
No pain. How about your depression?
Depression is almost all gone.
Well,
I really can't believe that I feel this good.
Good. Okay. So how long have you not taken any medication? You say your doctor prescribed to you, but you never take them. How long have you not taken the medication?
Since 2010, I believe it is.
So since you come to see me?
Yeah.
Okay. So here you got lupus, depression, arthritis, pain all over the body, but you don't need to take chemicals. Okay. And Lynda only come to see me once in a while. Medicare pays 3 treatments every 2 months. And many times because of transportation, she missed her treatment. Nevertheless, you have not taken any medication since you've seen us.
That's true.
Yeah. Okay, we will follow up on Lynda, and next week, in 2 more treatment, we'll take you again. Okay?
Okay.
Yeah. Thank you very much.
Thank you, Dr. Tong.
Yeah, thanks for sharing your story.